So forget to start on the recording, so starting from the middle. So this do you remember the action on the action uh, action on the blood pressure, these cues? Someone join? See here, testing. Someone join. Okay, so what do you think? Actually, we see correct answer here. So what do you think from this is correct? Sandy?
No, I don't know.
Don't know. So,
No.
do you remember the norepinephrine? How norepinephrine will act uh, on the blood pressure?
It raises it.
So it raises. So,
Increases blood pressure.
but how? So we just discussed that here. This one. This one. Epinephrine. Sorry, not norepinephrine. Make this, and then so norepinephrine did not cause any significant change, like retreatment with the alpha blocker. So no, almost no change. So this is norepinephrine normal without anything, then retreatment with the drug that is alpha blocker. So then we can so suppose that this drug is alpha blocker, right?
Yes.
Because if it will be beta blocker, then norepinephrine will still make same. So there will be no change in the, but because there is no effect of norepinephrine, then we suppose it's alpha blocker. So then we have here prazosin alpha 1 selective, then propranolol metoprolol is the beta blockers, clonidine is alpha adrenomimetic, alpha 2 adrenomimetic centrum, and then we have
Then it's E.
sorry,
Then it's E.
E, why?
Carvedilol.
Why?
It's the only one who is an alpha blocker.
Okay, so let's see. Correct answer indeed is E. You are uh, right again, Sandy. So
It's the only option.
left. So norepinephrine blocks both alpha and beta and increases heart rate and blood pressure. So okay, we know that already. Prevents the increase in the blood pressure caused by norepinephrine should be similar to carvedilol that antagonizes both alpha and beta receptors. So prazosin is actually alpha, but is alpha 1 uh, antagonist only. So uh, oh, sorry, and I forget about heart rate. So uh, so in this case, we need norepinephrine not only not So no change in the blood pressure or heart rate. So and also heart rate. So if there is no heart rate here, we can use prazosin too, because prazosin will block uh, the action of the norepinephrine to the blood pressure, but not to the heart rate, because heart rate is beta 1 and prazosin is alpha, is pure on alpha. But carvedilol is alpha beta. It blocks both alpha and beta, and that is why it's correct. But if we remove here the heart rate, then prazosin is also correct. Okay. So uh, propranolol and metoprolol, anyway, they cannot prevent the uh, change in the blood pressure. So okay, good. Then let's see, the next one is beta blocker, prescribed for hypertension in a female asthmatic patient. So beta blockers. So in asthmatic, uh, you should be careful with the beta blockers. So we only can prescribe the selective beta 1, because beta 2 blocker will be not is contraindicated in asthmatic patient.
So in asthma, it's only beta 1?
Yes, only beta 1 blockers selective are prescribed, because beta 2 will lead to the asthmatic uh, attack always. So that is what contraindicated completely. Even beta 1 are prescribed in low doses, because in high doses they lose their selectivity. So after a week of treatment, asthma attack got worse, and the patient was asked to stop taking the beta blocker, which are the following to suggest in alternative in this patient that is less likely to worsen her asthma. So probably propranolol was prescribed first, because it's non-selective. So what do you suggest? So propranolol is is beta non-selective, will block beta 1 and beta 2. Metoprolol is beta 1 selective, metoprolol. Labetalol
Then it's B.
B. Okay, just look through the rest. Labetalol is alpha beta, and carvedilol also alpha beta.
B
Non.
is the only one who is selective B1.
Yeah, so
Yes, teacher, I think also it's B.
I agree with you. Let's see if it's B. Yes, it's B. So it's beta selected. That is why it's B. Actually, they have a B here is uh, uh, helping you to to select. So beta is actually beta 1. That is important that it is beta 1, because then uh, beta 1 receptors are in the heart, and beta 2 are in the lungs. So in the bronchi there is a beta 2, and that is why metoprolol will not uh, act on the beta, will not block the beta 2 receptors in the lungs, and will not lead to the asthma attack. So that is why only metoprolol. And first was propranolol, because it acts on both beta 1 beta 2. So and beta 2 antagonism is not is bad for the asthmatic patients. Uh, so an alternative is to prescribe a cardio-selective beta blocker. So it's metoprolol. So it's easy. Cardio-selective. They call it cardio-selective because beta 1 is in the heart, and that is why beta 1 selective and cardio-selective is the same. So it's actually synonym. Metoprolol is a to selective, so propranolol and carvedal non-selective. That is actually true. Okay, let's go further. So this is a male, male, female. So they change it. So old male. So you not have you noticed all the patients are old patients, because mostly these drugs prescribed for old patients because hypertension is the disease of the old people. So with the alpha blocker for incontinence due to enlarged prostate. So actually this is a male and he has a erectile dysfunction, the disease of the prostate. So actually can be only seen in male because prostate only find, so it's only exists in the man. Uh, would you suggest not affect his blood pressure significantly? So actually you need a alpha blocker that will selectively block the alpha receptors in the prostate, particularly alpha 1b that are located in the prostate. Do you remember the classification at the beginning of the lecture? We talked about that,
The alpha and beta receptors.
about this subtype alpha 1b that is in the prostate. Those of you who will be super have a much attention at the beginning. So those who
The
were
problem
late,
is that there are way too many names.
too many names. Okay, I will
Yes, so
give you a hint. It is tamsulazine. Let's see if it's correct. Yes, it is tamsulazine. So when we started the lecture, those of you who were late, you can uh, look to the recording. I will publish it in my YouTube channel. So if you are not subscribed yet, so subscribe to that. Especially if you are late for the lectures frequently, it will be very handy for you. So I publish 2 lectures every week in English, and then some also botany also for 1 lecture a week, and then sometimes a practice fit. So you can also revise the botany if you if you wish. So for free. So actually, uh, so the tamsulosin is actually the only one selective alpha 1A uh, blocker available nowadays. Uh, so actually it's alpha 1A. So alpha 1A blocker, and the in the blood vessels it's alpha 1B. So that is why tamsulosin will not affect the blood vessels, and we need the same. So not affect his blood pressure significantly. That means not affect what alpha 1b. So others are not selective. So they block all the alpha or all alpha 1. So prasazine, doxazazine, and terazazine are alpha 1 selective, but they are not selective to alpha 1a and b. And then phentolamine is completely non-selective, is blocking all alpha 1, alpha 2, alpha 3, and all alpha receptors. So when you talk about the selectivity in pharmacology, it's not enough to say it's selective or not. You should say what kind of selectivity it has. Like alpha selectivity means all alpha. Alpha 1 selectivity means that alpha particular subtype 1. and then they can be alpha 1A and B, so it's deeper, 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 and deeper. So that is why you should learn all this, and also you should learn that alpha 1A subtype is in the prostate of the male, so it's not seen in female at all. So that is why it's very important for Ibrahim and Mustafa and Mohammed. So where is Mustafa? Mustafa, so it's gone. So Mohammed, 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 for Mohammed. Are you here? Any uh men are here? Huh? No men? Ibrahim? Mohammed? It's very important for males. So if you will have this, or like your patients, because I know in Egypt, because of the Muslim, it's Muslim country, and the pharmacists are halal, right?
What do you mean?
The pharmacists are halal, like they only offer halal medicines, right?
What are halal medicines and non-halal medicines?
Like they
Teacher,
don't use uh, the animal products. Like for example, the insulin is not obtained from the pigs.
yes, it's from cows.
It's from cows. Correct.
Yes.
Exactly. The same is in Tatarstan, in Kazan.
Uh-huh.
The insulin is obtained from the cows because most half of the population is the Muslim, and that is why it's haram to use the uh, and then also cows should be slaughtered correctly, so the meat and the all other parts, so the insulin from them is will be allowed. So, and I suppose that uh, in Arabic countries like the like other, so most Arabic countries also the pharmacy, there are pharmacies for men and for female, like, and in men pharmacy you will find a pharmacist, a male pharmacist, and in female pharmacy you will find a female pharmacist. No.
We don't
No.
have like this.
You don't have, like some countries have, because some universities in Saudi Arabia, for example, they have like two professors. One professor is female and other professor is male, and female students will go to only to the female professor, and male will go to only to the male professor.
No, we don't have
Which
this.
you don't have, what some?
No, no.
Maybe, yes, maybe in one pharmacy there is two pharmacists, one male and one female. So the males ask for male and females ask the female to
Exactly.
not feel bad.
Exactly the same. Yeah, I mean that.
Mhm.
I mean that. Not, of course, not different pharmacies, but two pharmacists in the same. It's like you
Mhm.
have a choice. Like if your religion does not allow you to speak with the males without the husband's permission, then because you are not with your husband, you are alone, and then so it's not. Uh, so that is why always you have a choice. So and
I think it's here. It's mostly because, like, women prefer female doctors or pharmacists, and male prefer male doctors or pharmacists because sometimes they have issues which they are too shy or embarrassed to discuss with the opposite gender.
I see,
So,
and that's true here as well. So we have, but it is not because of, maybe it's not because of the shame. It's maybe because of the religion, because religion, is like education and religion. So it's actually combined. So that is why. Anyway, so for the uh, it's true, even the non-Muslim in our country, they prefer to discuss prostate diseases of the men with the men physician. So that is why most of the uh, urologists in our in even in Russia, they are men, not because most patients that have uh, uh, urologic diseases are men, and vice versa. The gynecologists are most female because the only patients that you have in gynecology are the female patients. So, and uh, the same is for the gyne gynecology, but for the gynecology, the men are also common because they are better surgeons. So, and some female prefer the male because they are better, just better, because like for some reason, uh,
How are they better?
it's like they have a better knowledge and better skills. So that is why some women that are not Muslim mostly, so Russians, so the uh, Orthodox women mostly prefer, so can prefer the male, but not because of the gender, but because the skills are higher. Like surgeons mostly are men in Russia because in our country and in other countries also, like most famous surgeons are men because it's hard work for women to like to stand for several 5 hours, and then uh, surgeons are usually very fat also because the profession is very nervous and like very, and women are not very much like they there are some women also very beautiful, brilliant, but still it's very time consuming, hard, and uh, women usually require time to raise the children and then to care the family, and because they cannot sacrifice that, uh, so like usually in our country it's traditional in families, uh, women will keep eye on the children mostly, and men will like work hard. So and because of the surgeon and it's a hard working, like requiring much time and uh, much of force, like much even physical it's like energy. So that is why most uh, surgeons are men, and the same is in most countries because usually female surgeons are like ophthalmologists, where the there is not much force required. Like you have a bone and you have to cut it, you need a much force to press on that, and this if a female is like a tiny, don't have much force to press that. So it's like actually harder to do. It's still possible. Still possible. That is why there are some few female surgeons, but mostly are men. So we are returning to the prostate. Still no males here. So Sandy and uh, unfortunately Sandy and Salma, now you have to learn about prostate because our men are gone. So next time someone will visit your pharmacy, and then you should tell that unfortunately uh, I have to explain you about the prostate because when we studied this topic in pharmacology in the university, our males were absent. So the thing is that tamsulosin is actually uh, will block the uh, will block the alpha 1A subtype receptor, and that will decrease the size of the prostate, and the prostate will decrease in the size and will not press to the urinary tract, and that will not, so when it's large it presses to the urinary tract, and then during the urination a patient will feel pain, and urination is very painful, and that is why and medicines are usually not effective. So Ahmed, very good. Ahmed, it's very good that you joined us now because we're talking about the prostate disease that is actually for men. So do you know what is a prostate? Ahmed, Ahmed, switch on the microphone because you forget to switch on. If you want to speak, you should switch on the microphone first. Okay, so
It's girls only today.
anyway, uh, men should not be shy to speak about that, especially we are professionals, so we are pharmacists, so it's like education. It's not actually any shy to speak about the prostate disease because it's very actually very common in old men. So in young men it's not seen at all, but in old men it's very common. So and then the urination is painful, and the painkillers are not effective. Surgery is very dangerous, so because actually uh, surgery on the penis is very uh, mm, painful too, and also will left them. So actually, the after the surgery, there are some problems with the stitches because they will go off every time the uh, penis is erect, and that is a problem. So after the surgery, men should not feel any erectile or any erection, but they can feel because of the some reasons. So and every time they feel, they will have to go to the surgeon to make it again, to replace the stitches. So and also it's painful, and then there is a infection added because of the bad hygiene, because men usually don't take much or don't care much about the hygiene of the penis. So that is why all this lead to the infections, then complications, etc. That is why surgery is not a good option. So and that is why tamsulosin is become so it's very popular, and actually the treatment is not as good as so it's not as effective as the surgery, but it's better in terms of the complications. So because there are no complications and side effects are minimal, and that is why in the uh, when the treatment in the early stages it may be effective, but still surgery is better. Like surgery will treat it completely. Tamsulosin will not treat completely, but sometimes is more or less effective to reduce the pain and to continue uh, uh, with the normal urination. So, and urination is actually effective, is very vital, because without urination, actually, patient will not survive. Alternative option is bypass surgery for the urination box. Then patient have to keep the urine bag with him or with him all the life. So it's not actually convenient too. So okay, then let's go to the next. There are 3 other questions left. Oh, someone here. I'm sorry. Correct answer was C. So smell again. Emergency room. So stung by a hornet. Do you know what is a hornet?
No.
Uh, so it's a musical instrument.
Is it like a bee?
Like what?
A bee?
What is a bee?
Bee.
Bee?
Bee, honey.
Yes, yes,
Where we get honey from.
yes, yes. It's like a bee. So, but it's larger and more dangerous.
Okay. Is it poisonous?
Yes, it is. It's
Mm-hmm.
like it's a poison, and the patient has an anaphylactic shock that is very
Teacher,
common.
you said it's musical instrument,
Yes, hornet is actually also a musical instrument.
which we blow in it.
Yes, it's blown, but in this particular case, it has 2 meanings. Hornet has 2 meanings. Like in this particular case, it's actually animal. It's a fly.
Uh-huh.
So the it's like hornet. Let me show you. So
I know the musical instrument, but in the question it was he was stung by a hornet, so I did not know the insect.
so hornet is like a large bee. Also, it has a so it's aviation. It's so there are many in the maybe I just missing maybe it's like spelling is similar, but I'm not sure on it. So you have it at school, stuck by a hornet. So I think it is like a musical instrument too.
I know the musical instrument, but I did not understand it in the question because
Yes, me
stung
too.
by a musical instrument, so I did not know what the hornet is.
Okay, uh, but I think for the most people that don't have musical education, so hornet is actually B. And it's like actually stung by a hornet is not a very common thing. So okay, that is why it's B. Uh, so this is an anaphylactic shock uh, because of the allergy. So because I suppose this patient has a stung before, like it's not the first. That is why anaphylactic shock. And bronchial constriction is the symptom of the anaphylactic shock, and hypotension is also. So these are 2. Bronchial constriction leads to the decrease in the breath, and then the death, and hypotension is will also lead to the death. So that is why anaphylactic shock is very dangerous, will lead to the death if not uh, inserted the if not inject the epinephrine or adrenaline. So this is the same. So the epinephrine is injected, but no response to epinephrine treatment. So and then the patient was married, so and his wife was nearby, and then told that she is taking antihypertensive medicine, but she don't remember the name because she is not a physician. So, and then the pharmacists were nearby. So there is an emergency room full of the uh, physicians, but they don't remember exactly name of the antihypertensive medicine. So now you need to save the patients from the death. What do you think? And you are just pharmacists that working in this hospital and running by and see they argue what is the drug. So what do you think? Antihypertensive. What do you think a man will take as an antihypertensive drug? Okay, let's return to the lecture. So we have epinephrine. So we take epinephrine. This is effect without the blocking agent. This is the effect with the alpha, and this is the effect with the beta blocker. What do you think? We have alpha or beta?
Are you
Beta
presenting
blocker.
something? Because I can only see the question.
I show you the. Sorry, a moment. Uh, Now it's better.
Yes.
Okay, so this is epinephrine. This is uh, epinephrine with the alpha. This is with the beta,
So
and
it was beta.
it is correct. This is beta because uh, it tells us there is no effect like here. They
Mm.
are alike, and here it's reverse. So if the patient were taking the alpha blocker, then we will see reverse, but we don't see reverse. That is why actually we conclude it's beta blocker. Then let's see, doxazazine is what is alpha or beta?
Alpha.
It's
It's
alpha.
alpha.
Okay, then we have propranolol, that is a non-selective beta, and metoprolol also. We have this all.
Yes.
So
All are beta.
but propranolol is non-selective, metoprolol is selective, and acebutolol also selective.
So it's B.
Is B propranolol? Okay, let's see. Yes,
Non-selective.
indeed, it's B. So because selective is like metoprolol, acebutolol will not block completely the alpha or the epinephrine, and propranolol is will block all beta 1 and beta 2. So and uh, uh, so actually both receptors are required to block, and propranolol is the only one that blocks beta 1 and beta 2. And the action of the epinephrine is beta 1 is on the heart, so it decreases the uh, uh, hypotension by activating beta 1 in the heart. The heart will pump more blood and increase the blood pressure. And bronchoconstriction is activating by beta 2 receptors in the lungs, in the bronchioli, and then prevent the anaphylaxis. So, actually, this is the so propranolol is actually still used despite it's non-selective. Sometimes it's preferred to the selective. There are some cases, usually in men, because of the heart, because metoprolol will lead uh, to the congestive heart failure frequently. That is why in men nowadays they prescribe propranolol sometimes. So, and doxorubicin is alpha blocker, that is why will not act completely. So actually it's easy here. Okay, then let's see what is the next. So what do you think? Alpha adrenergic blockers used in the treatment of hypertension in anaphylactic shock. So like we see before, we use, do we use the propranolol? Hypotension in anaphylactic shock. So hypotension decrease in the blood pressure and alpha blockers will decrease it more. Will we use them or not?
No.
Of course no. We already have a hypotension. We don't need decrease. We need reverse. We need vice versa. We need to increase it. That is why, of course, no. Adrenergic blockers in treatment of the prostatic hyperplasia. Benign
I
prostatic
think yes, we just
hyperplasia.
discussed it in a previous question.
Exactly. This is actually uh, common, but not all of them. Only tamsulosin is used because others have uh, the adverse effects, hypertension. So, but actually they are effective too, but still more adverse effects. So usually selective tamsulosin is preferred to reduce the adverse effects. Okay, that is why probably B is correct. Then alpha adrenergic may cause bradycardia.
No.
No, because they lead to the tachycardia, vice versa. It's reflective tachycardia because the body will try to increase the blood pressure by pumping the more blood. So will be tachycardia, increasing the heart rate. And bradycardia is decreasing the heart rate. Then alpha blockers in the treatment of asthma.
No.
No, they are contraindicated. Uh, Actually, not contraindicated, but they will not affect because they are alpha, and in asthma it is beta 2. So that is why they will not be used. And reduced frequency of urination, actually not connected at all. So there is no any connection between alpha receptors and frequency of urination. Frequency of urination depends on the amount of the water you drink and also the temperature of the air, because in the cold you will feel urination faster. Are you have you not noticed that, ladies especially? No,
I think I noticed it, yes.
because in the cold weather usually, or when the heating is not on yet, in the buildings, in the university, or um, there were like when I was a student, there was construction in the building and the heating was not uh, uh, working at all, and there was so cold outside, so we have to wear the jackets inside. And the lecturer said us that like we need to decrease uh, the duration of the lecture because of the cold. You feel more urinary emergency, so you have to visit toilet frequently. So, and that was actually the case. So okay, let's see if it's correct. I think it's correct. Yes, it's correct. So because they relax the smooth muscles of the prostate. So then let's see what is next. So the next is beta blockers. So is A correct? We talked about that during the lecture. Treatment with the beta blockers should not be stopped abruptly, sharply.
I think it's correct.
Yes, it's correct. We talked about that much, so it's very important. So you should decrease the dose at the end of the treatment during 1 month or weeks at least. Because elsewhere you will get arrhythmia. So propranolol is cardioselective. It's not cardioselective, it's alpha beta blocker, non-selective beta blocker. So beta blockers may cause orthostatic hypotension. Yes, all the antihypertensive methods will may cause orthostatic hypotension. That is the lightheadedness when you stand fast. Then cardioselective blockers worsen asthma. Is that correct?
No.
No, because cardioselective is beta 1 and asthma is beta 2. So that is why they will not worsen asthma. And the last blockers, beta blockers decrease peripheral resistance by causing vasorelaxation. It's correct or not? It's not correct because they cause vasoconstriction, vice versa. Because beta receptors in vessels, in peripheral vessels, lead to relaxation. Stimulation of receptors lead to relaxation, and that's why blocking of these beta receptors, beta 2 actually, subtype receptor, lead to blocking of this receptor lead to vasoconstriction, vice versa. That's why this is incorrect. So we only one we have left. What was correct?
A.
A
Yes. This
should
one is correct.
not be stopped abruptly. Yes, this is correct. And C may cause orthostatic hypotension.
No.
Why?
Not correct.
They may cause orthostatic hypotension too. Beta blockers. I think C is also a little bit correct. But yes, A actually more correct. Let's see what is the... Yes, correct is A. But I don't know why C is actually a little bit correct. So actually correct too. May cause orthostatic hypotension. Okay, let's see what
But
is
maybe it's rare.
rare. Maybe. It says may. May means that not all the time. So it's rare also. But I think C is actually correct too. But yes, of course, A is more correct. So like here, you see, they ask you to choose not just correct, they ask
The
you
most correct.
best answer, best. So of course A is best. So if you want to be best student, then you have to choose best answer. So uh, so hypotension, okay. Yes, upregulation of the beta receptors is increase in the beta receptors number when you use beta blockers. Direct vasoresistance, no. Less likely. Yes, it says less likely to cause hypotension. That's true. Less likely. But they say may actually. Maybe or may not. Okay. Then, but actually C is correct too. So just less correct than A. Okay, then actually other answers, like I will not hide the correct, actually this commonly topically glaucoma is timolol. Like you just need to remember that is used in ophthalmology to treat glaucoma. Atropine is contraindicated during glaucoma because it will predispose the glaucoma attack. Tropicamide is used in ophthalmology, but the indication is different. Indication is also tropicamide is same as atropine. Indication is also contraindicated in glaucoma, and tropicamide is used to check the eye vision. And scopolamine is not used in ophthalmology. It's actually same as atropine but central. Scopolamine is used for motion sickness. Do you have motion sickness?
Yes, I do.
So, Sandy, if you want to prevent motion sickness, take scopolamine before you board the vessel.
Is it important? I usually just ignore it.
Yes, it's important because if you plan to travel for a long time, and it can become worse every day. You will feel nausea, vomiting, and all your journey will be ruined. So that is why.
Yeah, actually, sometimes when we are traveling for like a very long road, we have to stop multiple times because I don't feel good.
So that's if you take scopolamine, and then you don't need to stop frequently, but take it like several hours before, like 4 hours before, and during all the journey, like regularly every 6 hours. So, and you will not feel anything. So, and how do you travel?
Uh,
By car?
this summer I traveled by car, yes. But it also happens in planes, it happens in public transportation.
What transportation?
Public transportation. Like buses,
Buses?
taxis.
Public, I see. Uh,
Hmm.
but uh, with the usually it's only seen with the vest boats because there is much
Yes, it happens
shaking.
in boats too.
In boats it's usually more prominent, so that is why if you ever plan by boat, you should take it like without scopolamine. You should not go to the boat at all because on the boat you cannot stop.
Yes,
The
yes, I
captain will
understand.
not stop
I only had one experience in my life with this, and I never repeated it. It
because
was a fun trip, but I did not feel good at all.
that was not fun, right?
No.
So because you forget to take this, if you take scopolamine, usually it's sold under the brand names like Aero or something, for, like against the air sickness. So if you go to the pharmacy and ask medicine for the air sickness, then you look on the uh, content, and then scopolamine will be there. So it's actually the adverse effects is like only a little bit. Uh, you may feel a little bit uh, thinking, like you will think slower a little bit, but that's fine during the travel, during the summer holiday. So and it's important to take it before, because once you have motion sickness developed, it will be too effective too, but it will be less effective. So it's better to take in advance. Uh, and usually in the car, if you have flat roads, you don't have much symptoms. Or if you have a good suspension like mine, so I s- I hope last time when we traveled you don't feel.
No, no. Roads in Russia are very nice, and drivers are usually very slow. So it's nice. Here it's not like this.
uh, Unfortunately, Sandy, you were lucky that uh, you study in Kazan because
Yes, yes, I was about to say this. When I went to Moscow, it was very bad.
in Moscow actually they're good too, because in other regions except Moscow, St. Petersburg, and Kazan, the roads are so much worse that actually the car suspension is not surviving much. So that is why most Soviet and Russian developed vehicles have more rough suspension to resist, to survive in harsh road conditions. And that is why they don't make a suspension well. So that is why the passengers usually feel uh, more shaking. So, and that is why they develop actually disease. So okay, then correct regarding Carve di Lol. So actually C is uh, alpha blocking activity. Actually, we already know that because we discussed Carve di Lol before. So actually, so it's non-selective actually because it's alpha 1 and beta non-selective. Uh, and yes, it's contraindicated. So it's treatment of stable chronic heart failure. Uh, so actually, it's not contraindicated. It's used for the treatment of the heart failure. So we will discuss it uh, in deep when we start the heart diseases next semester. So that is all for today. So next week we have a test. So what do you think about the test? I prepared MCQs.
Hmm. Good.
So I think you can make that MCQs and actually during the week or anytime uh, you are ready, then we can, if all of you are making MCQs, done with the MCQs, I think we can start a new topic, right?
Next week, you mean?
Yes, or if you are not yet done, you can make the test during the class, so you have time. So after the lecture, you have several hours, then you can make the test, and then we can start new topic 2 weeks later. So it's up to you how uh, when to make a test. Uh, is not time limited, so take your time to check the answers, and so you have a higher score.
I'm sorry, you said that next week we will have a test and we can do it during the week and then